background has been in senior living and healthcare only. Myself, my business partner, Mike Mattingly, and our entire team, that's what we've focused on. And so we have combined decades of development experience in senior living, working with hospital systems, primary care providers, value-based care providers, on like the real estate side. And because of that, we've had to learn their operations and get to know those models well. And as in more recent years, we've done more and more of the value-based primary care medical clinic development for several different wonderful providers and providing them a strategic national platform for expansion. And what we saw in the combination of all of that was there is a silo of the senior living care continuum and kind of a silo of healthcare that is focused on senior wellness, but there wasn't really an integration of the two. And so we really wanted to bring a platform in an active adult 55 plus rental community model that integrated preventative care. This is not needs-based healthcare, but preventative care into a vibrant, active living community. And so Viva Bene is our operational model that is doing this. It's Italian for live well. And we think that really speaks to what we're doing. We want young, vibrant seniors to age well, in place, have an active lifestyle, and do it in a way that gives them what our partner Sevi Health likes to call generational health. One of the pillars of Viva Bene that we have is that it's accessible. And for us, accessible is the perfect word that also integrates affordability into it. So it's accessible for all, it's a welcoming community, but it's accessible from a price standpoint too. We are definitely reaching an affordability crisis for the next generation of seniors in this country. In 7 years from now, there's about 40% of the baby boomer population that will have a savings of $25,000 or less. And this is something that we truly believe is Teen Avenue, that not enough people are working on, and it is not serving the seniors of America who have worked so hard for us for generations. And so part of this model of Viva Bene, of bringing in a healthcare partner who is doing care coordination and primary care services on site, for our residents, is to help bring in some healthcare services, again, not needs-based, but on a preventative basis, to help people live better, longer, and age in place in their homes. And so on our Viva Bene platform with our partnerships, that access to our partner Sevi Health is included in the rent. And these rents are very similar to other active adult communities and multifamily communities in general in this specific market. So you're saving anywhere from 20 to 45% compared to a traditional independent living community. Active adult is relatively new. And if it's new within an industry that knows what it is, when you bring it out to a community, it is a brand new language. And so there has been a lot of education that we do in any development with municipal leaders, neighbors, community leaders, that we always want to educate them and get them involved in our development. It's very easy for those partners to understand once we explain what senior living is assisted living, memory care, skilled nursing. They have experience with family members in that, so there's a visual that they can have. When we're talking about active adult, we have to really actually educate more than we do in a typical senior living process, because a lot of people just hear multifamily and the red flags go up. Multifamily in a lot of cities, towns right now is almost a 4-letter word because of the boom in apartments that has happened, especially in the last decade. And a lot of times they worry about the drain that has on municipal services, on transportation and roads, on school impact, et cetera. And so when we have to educate them on active adult of how it is like a multifamily community, but we do have age restrictions, et cetera, it eases some of those concerns. But I would say it has surprised me that a timeline to get through entitlements may be slightly longer because of that education process than it is with a typical senior living community. Programming, which we call our Propel platform on Viva Bene, is something we have literally a team have spent years developing, along with our healthcare partner, Sevi Health. This was a pillar that was incredibly important to us because we want this to still be a social community. I think part of the reason that seniors decide, a young senior may decide to live in this type of community is social. They may live alone and want to be around friends. So we wanted to keep what other active adult communities have, that social engagement piece, intact. But what we also wanted to do was have those socialization activities, the programming pieces really revolve around our theme of wellness and how you can live a healthier life, like longer, in a Viva Bene community. And so all of our programming goes around that theme. So we have created, from a development design standpoint, a wellness hub in our building that has the access to our Sevi Health Clinic, that has the fitness center. It has a traditional cardio center, but also a mindfulness room that can be used for meditation or yoga, and different programming for that. And then we have a separate room, we call it, it's a multi-purpose room, but that can really be used for a lot of different seminars on wellness education, cooking demonstration classes on how to cook not just your typical low sodium diet, right? But how do you have a fun diet that you enjoy eating that's also like healthy? And so all of those things can happen in our multi-purpose room that is perfectly integrated into the design of the fitness and healthcare clinic space. It's a blend of senior living and multifamily, which on its surface sounds like it could go both ways. A multifamily developer could develop active adult, or a senior living developer could. But it is crucial to have a lens in both arenas to do this well, because of the operational platform and the affordable rents that you want to achieve. You really need your operational chassis to look more like a multifamily community, from how you staff, how you come up with programming, how you handle maintenance. All of that really needs to operate in margins similar to multifamily, but have some of the high touch components and detail orientation that you have in the senior living community. As we were developing the Viva Bene model, even before we knew what Viva Bene was or that it was going to be specifically active adult, we focused on the end goal before defining what it was. And the end goal for our team was to create a new affordable model of senior living that would allow residents to age in place with preventative care services. And the outcome of that is truly a new operational platform that integrates healthcare, well care, with a residential community. There are lots of senior living communities right now that are integrating primary care services, maybe with health systems. We're doing that too, but it is not necessarily where both sides are working in a true interconnected like company. It has been before, like in silo, that one company comes in, visits a community, maybe it's a rounding physician, and is completely like separated from the senior living operational residential care model. What we're doing with Viva Bene, and this will be done in steps through several years, is going through a process of truly creating that interconnected company where a resident's health and wellness also impacts the bottom line of a community on top of the typical real estate NOI that investors look at. And so we are really integrating with our healthcare partners to create a platform that is similar to value-based care, that you take more risk, you get more reward for a patient life in value-based care. And we want to create a platform with Viva Bene that does that on the residential side. And so we are really incentivized in a non-needs-based healthcare setting, but again, more preventative care to keep our residents healthy longer and living a better quality of life. I think anything in life that becomes partially successful is always a little bit of hard work and a little bit of luck. And the team as we've talked about from a development standpoint of senior living, has a vast amount of experience, from legal to construction to development to accounting to operations. And what we have also done unknowingly is some background in multifamily development and construction that our team has had. And so we are able to bring together some pieces of all facets of multifamily, senior living, and healthcare, and combine those three pillars into an active adult model. And all three of those are incredibly crucial to be successful.